Do any of these unhealthy eating behaviors describe you after having weight loss surgery? Extreme obsession with your weight, like you can't get away from the scale. Thinking of old diets, how to repouch, how to have a revision, how to restart. Finding yourself calorie restricting, skipping meals, having some real anxieties and fears about food. Feel like you have to make up for a binge, like restrict or skip meals, or maybe excessive exercise, worrying so much about your body image, feeling really out of control around food, and maybe even developing a preoccupation around the pureness of food or the cleanliness of food. Do you think you might have an eating disorder after having bariatric surgery? Let's find out. Surgery is just one tool. It's time to put the other tools in the toolbox because it's your body, your health, your life. Some of these red flags, signs, symptoms were me before having surgery for sure. But even after surgery, they kind of started to rear their head again and even kind of get a little bit worse. And then I was starting to think, am I developing a true, legit eating disorder? So I did my research, and there's a term called disordered eating. Let's find out what that's about. Because we're really trying to figure out how to have a healthy relationship with our food. Is this you? If it is, let's start from the beginning. What is disordered eating? So let's first make the distinction between disordered eating and having a diagnosable eating disorder. Essentially, disordered eating behaviors, those problematic eating behaviors, lands on a spectrum, like a continuum from one end to the other, kind of a middle point, or if you want to think of it like a pendulum that kind of swings back and forth. So at one end, you'll have normal eating, which is where you as a person eat to a signal of fullness. You don't restrict your calories. You're not worrying about food. You're fueling your body with food. You're eating to live, not living to eat. And then, way over on your other side of your spectrum is the diagnosable eating disorder. For example, like anorexia nervosa, bulimia, binge eating disorder, other specified feeding eating disorders, and avoidant restrictive food intake eating disorder. So, the exact cause of eating disorders is unknown, but several factors contribute to the disease. Eating disorders, especially for women, kind of can start in the teen years, the young adult years. These are the ages where typically people are focusing on their body image, their self image. The illness can also run in families. Some emotional disorders like OCD, obsession compulsive disorder, or maybe even depression can increase the risk of developing an eating disorder. Eating disorders can have serious life threatening complications, so it's super important to understand these conditions and get the help if need so. Doctors use psychological and physical diagnoses to determine a clinical diagnosable eating disorder. These criteria are outlined in the DSM 5, the Diagnostic and Statistical Manual of Mental Health Disorders, the DSM 5, which is published by the American Psychiatric Association, the APA. For now, it's important to recognize that some of these issues that I talked about, these behaviors I talked about at the beginning of the video, and before we dig a little bit deeper into those, they may not seem as bad as the clinically diagnosable eating disorders mentioned, but they're still harmful. And we know they can cause real mental and emotional anguish and have some real physical consequences. In addition, disordered eating is the greatest predictor of developing a diagnosable eating disorder. Fortunately, when signs of disordered eating is caught early on, people have the greatest chance of not only recovering, but thriving and achieving self acceptance. How common is disordered eating and what is actually the impact? Unfortunately, disordered eating is very common, especially among women. Even though it can be found across genders, there's a disproportionate amount of women that suffer from disordered eating. Whether you want to talk about it or not, it can impact your overall health as well as your weight loss surgery journey, long term success. And not to mention negatively kind of impacting your relationships and your quality of life in general. Remember, it's super important to understand that health is not determined solely on your weight. And no one should push their agenda of their own body and their opinion, impression on your body. That being said, I am not formally trained in diagnosing eating disorders, but I thought it was super important to share this information, my journey with it, what I've learned along the way. So at least people are having the conversation with themselves and understanding how this can impact your bariatric journey, but also just your life in general, and understanding if you need help. So I've decided to create a series of videos. This is the first one of the series so that we can open the conversation about this. And remember, it can get even blurrier with us as bariatric patients. Sometimes disordered eating behaviors, those problematic eating behaviors, can manifest themselves in binge eating, stress eating, emotional eating, kind of food addiction behaviors. And I know it's super uncomfortable to talk about these things. Before we go any further, I want you to know that you matter, that you got this, that we can figure it out together. The importance of loving your body no matter what, at whatever stage. And how you approach health and that overall health and well being has to include your relationship with food. Before we go any further, can you please help me get the message out there? Please like or share this video. It just tells the YouTube algorithm that this is an important topic, that there's people out there and that we're not alone. Signs and symptoms of disordered eating. You got to understand that this list that I'm going to present should not be intended or worked on as a checklist. Understand that everybody is unique and that disordered eating and or an eating disorder will present differently in each person. This is just kind of a list for you to recognize red flags at any time. During this video, after this video, a few hours later, please, if you feel that you are concerned in any way, contact a licensed professional. And remember, as bariatric patients going through our weight loss surgery journey, some of these things present naturally after having bariatric surgery. This is where I need you to critically think. Take a moment, be self reflective, listen to them, remember the pendulum, the continuum. Where does that fall for you? How intense is the following for you? Does it create some instant memories? Does it trigger something? How much time do you spend on them? To what degree? So grab a journal, grab a pen, grab a book, a notebook, and just chart down maybe even a really quick continuum, like normal eating's on one end, diagnosable eating disorder on the other, put some points in between. And just as you listen to these, just kind of, no shame, no judgment, no guilt. Just kind of think about it. What does the intensity work for you on these? So let's talk about the emotional and behavioral kind of signs and symptoms. That preoccupation with weight loss and dieting, like beyond post surgery kind of effects. I'm talking about that it is part of majority of your day at the exclusion of other interests. The obsessive of monitoring your weight. Like how many times a day are you weighing yourself? Are you obsessive with monitoring calories, macros? Are you really concerned about the makeup of the food? Are you starting to skip meals? Are you dramatically reducing the calories beyond what your program might tell you? You're refusing to eat certain foods, not because you're having food aversions because of the surgery. You're just refusing to eat certain foods or whole groups because you're really concerned that's going to make you gain weight. You're starting to kind of be unwilling to eat around other people, especially your loved ones. You're eating in silence, or you're eating in other places than with your family. You're removing yourself. You have extreme concern about your body size, your body image, your appearance. Like you find yourself frequently checking the mirror, looking for all those flaws, concentrating super hyper focused on those flaws. The development or the enactment of food rituals, like, for example, you won't eat certain food items or you're dissembling food items. Just kind of that overall increased withdrawal from friends, family, loved ones, even work. You have extreme mood swings. Like now, after post bariatric surgery, there are some hormones are being disrupted. We kind of, some of us feel like some mood swings, but we're talking about extreme mood swings here. So let's talk about some physical signs and symptoms. You have marked fluctuations in weight. Now, stalls, a little bit of gain, that's normal during the bariatric surgery journey. But I'm talking about marked fluctuations where you're starting to know like major losses or major gains. That yo yo kind of showing on the scale is happening again. You're having additional kind of digestive issues on top of what we experienced post surgery, irregular periods, dizziness or fainting. So remember, some of these things I want to remind you are just kind of normal things that happen after bariatric surgery. Once again, this is not a checklist. This is where you kind of go, what is the intensity? What is happening here? It's just an opportunity for you to kind of, where do you fall with these certain symptoms on the spectrum? Dental problems from obsessive maybe or over vomiting, dry skin and hair that just doesn't seem to get better. Say you're quite a few months or even a couple years post surgery and it's just not getting better. Brittle nails, yellow skin, muscle weakness, poor wound healing. You have frequent colds, infections, illnesses. You just can't seem to get over them. Your immune system is pretty impaired. And then some people experience pica, P-I-C-A. It's kind of that persistent eating of substances that aren't typically food. They provide no nutritional value, and it can be as extreme as soap or hair, paper, and even kind of ice. Here's some other ones that maybe don't fall like neatly in the physical and or the emotional or mental behavior list. You find yourself making frequent comments about being fat, feeling fat, everything about this is how you feel is equal to fat. Making frequent comments or that extreme thoughts about your appearance and how that's tied to your feelings and how that's tied to your health and how that's tied to how you feel and your mood. Always needing that kind of obsessive needing to burn off the calories that you took in. Always feeling like your body needs to be fixed, like it's broken, like it's just always needs to be fixed. Engaging in obsessive and excessive exercise routines, like you have to do it and it feels just extreme shame and guilt if you have to miss a session. Those behaviors where you're starting to hide food wrappers or you're putting food, you're hiding it in certain spaces that you don't want your loved ones to know about. Maybe you're starting to eat in those spaces or stealing food. All these are kind of signs about leading towards a binge eating disorder. Are you feeling like you have to, or you want to, or you are already doing where you're taking frequent trips to the bathroom to purge after eating? You want to, or you already are there starting to think about taking laxatives or diuretics to lose weight. Once again, cutting out entire food groups because of the fear of gaining weight or partaking in really serious diet constriction thinking. So remember, that diet mentality before did not work for us. And then post surgery, now we're starting to think about those again. And we're willing to go back there and use whatever extreme measures to lose the weight. You find yourself, if by chance you have an illness or an injury, you have this extreme stress or anxiety about not being able to exercise or get rid of those calories that you have partaked in. Once again, not a checklist, not a self diagnosis, just some honest self awareness. Before you go, make sure you watch the next video. It's going to be a big eye opener. In that video, I go deeper about the red flags and what to look out for, as well as bust through some myths about eating disorders and disordered eating. I just know you'll be surprised about what you learn. So touch or click on the screen now, and I'll see you in there.